Holidays are a time for celebrating and making memories with family and friends. But research shows the hustle and bustle of the season is also a time that brings a spike in cardiac events. And that's why it's so important to be proactive about staying heart healthy all year long. And joining us to talk about heart health and new technology to treat heart disease is Palomar Health's Director of Interventional Cardiology, Dr. Mikhail Malek. Welcome.
Thank you.
Doctor, can you explain what interventional cardiology is?
The interventional cardiologist, they perform catheter-based procedure to treat heart condition to avoid open heart surgery or open chest to replace the valve. So through a puncture in the skin to approach the artery, we put catheter all the way to the heart and we open vessels, we replace the valve, and patient go home the same day or the following morning without even going to intensive care unit.
And doctor, why is it that hospitals see more cardiac events and heart attacks during this winter season and during December?
Yeah, between the Thanksgiving and the New Year, we see spike in people with heart attack. People are overeating, overdrinking, not taking their medications, not exercising, they are traveling and they are under stress and they don't pay attention to their body, and when they overeat they think they have indigestion or heartburn, but actually could be a heart attack.
And how do you balance preventive measures with interventional treatments?
Actually, both are very important and we should combine them. People should follow a heart healthy lifestyle to prevent the disease. But if they get the disease, we treat them with procedure, medications, then ask them to follow heart healthy lifestyle. And this include diet, exercise, maintaining optimum weight, avoid excessive alcohol, quit smoking, no drugs, control diabetes, control blood pressure, sleep well, avoid stress, and take the vaccines to prevent flu and other disease.
And how do you approach risk assessment and informed consent with your patients and their families?
We explain the procedure in details, including alternatives, risks, and potential complications, and answer all the patient's questions, then ask them to sign the consent.
And doctor, technology is constantly improving. How do you integrate it to provide patients with the highest level of care?
At Palomar Hospital, we have the latest and greatest. We have a lot of the high-end technology. We have the ECMO, we have the Impala device, we have the shockwave balloon which break calcium inside the artery in the heart. We have the latest stents, and we replace the valve, the procedure called TAVR. And we have ultrasound, we have the FFR, we have all the technology needed to make the procedure safer to the patient with good results, and they stay very short time in the hospital.
And how do you tailor interventional cardiology treatments to meet the patient's unique needs and preferences?
The patient needs will be achieved once we get the right diagnosis. So we do multiple diagnostic tests to get to the right diagnosis. Once we get the right diagnosis, we will be successful in the treatment and choosing the right procedure.
And can you give us your top tips to care for your heart this season and really all year long?
The best advice is diet and exercise. Eat healthy diet, exercise half an hour, 5 days per week. If you are hypertensive, take your medications. If you are diabetic, control it. Quit smoking. Decrease the alcohol use, sleep well. If you have sleep apnea, use the CPAP machine, reduce your stress, and try to sleep well.
Find out how Palomar Health is reimagining cardiac care. For more information, visit palomarhealth.org. Dr. Malek, we thank you so much for sharing your insight on this promising technology to treat heart disease.
Thank you very much for having me.
And we thank you for joining us on San Diego Living. We'll see you next time.